One of the things you need to do is get your hearing checked. The other thing, of course, to mitigate falls and risk is also, if you have had a history of falling, is you need actually to be more aware of your environment. You know, you need to take that extra caution by whether it's in the house, you need to remove those loose rags so that because you're more likely to fall if you have a hearing loss. So you need to be just aware of how the environment is. In the bathroom, most of the time I tell my older patients that put those handrails so that you're able to hold and support yourself. Because sometimes the dizziness comes as not just imbalance, but it comes as something we call vertigo. You feel like a spin, a dizziness that comes in. So, and it's going to make you lose that spatial orientation, knowing you're going to feel like the room is going round. So most of the time, how you mitigate that is just be very aware of the environment. And of course, if it happens once, then you need to have a hearing checked. Once your hearing gets checked, you need also to be done what we call a vestibular assessment. We say that part of the inner ear that controls our balance, that is just connected to the organ of hearing, is called the vestibular system. And now the test that we usually do just to see how it's working, is it functioning okay? We do a vestibular assessment. So you need to go to your audiologist so that they can have that assessment being done and find out, why are you finding the room spinning? Is it just to do with a hearing loss that you might be experiencing, or is to do something else that is going on in your vestibular system? Why sometimes when it comes to balance, there are so many things that affect your balance. One, we've said, of course, it can be a sign of a hearing loss. Second, it can be an infection. The other thing, it can be a viral infection that is happening. And mostly even patients who have other comorbids, if they're hypertensive, if they're diabetic, if they're being treated for any chronic illness, they're more prone to have dizziness. And also for people who maybe even work out and they're staying in one position for too long, they're more likely to feel off balance. So most of the time we don't assume that it's just a hearing loss. We want to find, we want to dig deeper. The balance issue, is it to do with the vestibular system just being not working okay? And then we are able to manage that.